Hi everyone, Dr. Timothy Gallagher here from Maragal Medical. This week we're going to be talking to you about all of the incredible treatment options that we have available here at our clinic. When you combine medical treatment with chiropractic care and physical therapy, you're going to get great results with our patients. You're going to want to stay tuned for more information about all of the services that we have to offer. So we've been talking to you a lot about all of the different treatment options that we have here at Maragal Medical, and I thought today a quick summary so that you understand all of the benefits that you would have coming to our clinic for treatment for pain associated with arthritis or neuropathy. First and foremost, we are Massachusetts' first integrated medical practice where we've combined separately medical care, chiropractic treatment, and physical therapy all under one roof. And that's going to make a major difference for you as a patient. You're going to get complete care. Our medical director, Dr. Marciello, is going to spend the time to give you a very accurate and detailed examination, oftentimes spending anywhere from 45 minutes to an hour with you. After that, we're going to have some treatment plan options, and you'll be able to sit down with myself or my associate, Dr. Sherman, and we'll go over all of the exam findings from Dr. Marciello. If he's ordered any diagnostic tests, that will be a time when we can review those diagnostic tests to talk to you about those findings. And keep in mind, as a clinic, we spend about an hour or so each morning before we see patients to talk about the patient's care plan and findings before we even see the patient. That way there, everybody is on the same page, a true team effort when we're looking at helping you with the treatment options for what you're presenting with. With the addition of physical therapy, we're able to have patients go through a very detailed physical therapy examination protocol. That's my wife's job, Dr. Colleen Gallagher, and she uses this cutting-edge robotics technology called Hunova to be able to, number one, find out what the patient's posture looks like, what their flexibility looks like, what their strength looks like, and what their balance looks like. There's some great video clips available on our website to show you exactly what the robotics technology does, and Colleen definitely finds it beneficial to take patients through their care plan and treat them on the Hunova robotics. The chiropractic treatment, that's standard. That's what brought this clinic all together. 25 years ago, I founded the practice, Dr. Timothy Gallagher, and have been serving the local community of Leominster and surrounding towns ever since with chiropractic care. My wife and I knew that at some point we were going to combine the physical therapy and the chiropractic practice and eventually get a medical provider. And in 2017, we were able to put that together. The chiropractor's role, and I'm talking about Dr. Dave Sherman and Dr. Rebecca Brooks, is so important. The chiropractor is going to be responsible for getting all of those joints in your body and the spine moving so that you're going to have some pain relief, but also improving the overall function. Again, everybody working together. As a medical clinic, we have a variety of other treatment options to help you get back on track and get out of pain. But I want to emphasize that we rarely prescribe medication and we rarely recommend surgery. We're not against prescribing medication or referring out for surgery, but if you can take care of a patient's condition conservatively, that's always going to be the best way. So instead of some of the medications, we offer 4 types of injections. We have our regenerative medicine injections, which include our Wharton's Jelly stem cell injections, as well as our PRP or platelet-rich plasma injections. Those are going to help to repair the damage in the tissue, whether it's arthritis or a partially torn tendon or ligament. The intramuscular injections, commonly known as trigger point injections, are such an important component to our care plan. When you oftentimes have those really tight muscles, it makes it very difficult for my chiropractors to get the joints moving, and certainly more difficult for my wife Colleen to focus on stabilizing the area when she's competing against those chronically tight muscles. Patients often refer to those chronically tight muscles as just knots in the muscle. What's happening is over time, the muscle overworks, it gets tired, fatigues, and you get a buildup of lactic acid, which is a waste product, which causes those muscles to stay in a contracted state. Those muscles can definitely be loosened very easily in the form of a trigger point injection. The difference is we really emphasize a holistic approach. So instead of using cortisone with those injections, we use a natural product called Serapin. Serapin's plant-based. There's no side effects. It naturally helps to relax the muscle, but more importantly, it gets that lactic acid out of the muscle. Then my chiropractors are able to get the joints moving better, and Colleen can work on improving those mechanical faults like your posture so those trigger points don't come back again. And finally, the last injection is called the sacroiliac joint injection. The sacroiliac joint injection is a real simple procedure. We use the same product, the Serapin, to help break up adhesions in that joint. Sometimes with chronic lower back pain, the pelvis, so the joints that make up around the hips, the pelvis and the sacrum, called the sacroiliac joints, they get a little bit restricted. Oftentimes the chiropractors will use a drop technique to try to get those joints moving, but in chronic cases where you have a lot of scar tissue buildup, it makes it very difficult. An easy procedure is called the sacroiliac joint injection. We do that under ultrasound guidance. That's Alex's, our physician assistant's expertise. We inject the Serapin into the sacroiliac joint. That in turn helps break up that scar tissue, gets the joint, a little bit more mobile, making it much easier again for the chiropractors to get a better adjustment in. In addition to the injection services, as a medical clinic, we have the ability to prescribe bracing, whether it's a lower back or a knee brace or a brace for the cervical spine to help control posture. We have that ability, making the clinic multi-service oriented. And finally, class 4 laser therapy. Instead of prescribing the patient an anti-inflammatory medication, which we can do, we always again try to emphasize a holistic approach. Class 4 laser is a wonderful modality. We have the ability to use the laser on different parts of the body that are injured or inflamed to help decrease the inflammation and help to accelerate the healing. Most patients see substantial response with the laser treatment within about 9 visits. So now that you have a better understanding of all of the different treatment options and services we have here at Maragal Medical, the easiest thing to do if you're suffering from pain due to arthritis or neuropathy or having issues with your balance, you're going to want to give us a call. More information can be always found on our website at maragalmedical.com, and I hope you learned something today. We'll see you again next week. Have a great day.